This video is going to be on thrombosis, which is the formation of a thrombus, or the formation of a blood clot within a blood vessel. And first I'm going to draw 3 arrows within an artery to represent normal blood flow. And then next I'll draw a partial obstruction, so a thrombus that partially obstructs blood flow, which results in reduced oxygen and nutrient delivery to the tissue and also reduced waste removal. These partial obstructions can result in ischemia, and ischemia is reduced oxygenation of the tissue. There can also be a complete obstruction, and this results in no blood supply to that tissue, so no oxygen, no nutrients, and no waste removal. These complete obstructions are more likely to cause an infarct, and an infarct is tissue necrosis, tissue death due to no oxygen delivery. Now, thrombi can occur within arteries, and when it does, we call them arterial thrombi, or they can occur within veins, and when that occurs, we call them venous thrombi. Now, there are various factors that dictate how severe the ischemia will be, or if an infarct develops, and one of those factors is the vascular supply of the tissue. So, for example, tissues that receive parallel blood supply or dual blood supply, those tissues are less likely to be adversely affected by a thrombus. So, examples of tissues with parallel blood supply are skeletal muscle and the GI tract, and examples of organs with dual blood supply are the liver and the lungs. Also, another factor is the rate of occlusion development. So, acute onset occlusions will be worse than chronic onset occlusions. And that's because if the occlusion has a chronic onset, there's time for the development of collateral blood supply. And that's essentially rerouting the blood circulation around the blocked artery or vein. And then lastly, another factor that dictates how severe the ischemia will be, or if an infarct develops, is the tissue vulnerability. So some tissues are more vulnerable to no oxygen versus other. So next I'm going to draw a thrombus, a partial thrombus within a vein, and it has a chronic onset. So there's time for development of collateral blood supply around the thrombus. So then when it does eventually completely occlude the vein, the blood vessel or the blood supply is able to reroute itself and still not produce obstruction of outflow of that area. Now, if there was an acute onset thrombus, then there's no time for collateral blood supply to develop, and you essentially get a complete obstruction. Now, these thrombi don't necessarily have to stay at the site they develop. Parts of the thrombus can actually break off, enter the blood flow, and deposit elsewhere within the body. When this occurs, the deposition of that fragmented thrombus is called a thromboembolism. So next I'm going to leave this image and go to 2 different images to demonstrate the difference between a thrombus and a postmortem clot at necropsy. The thrombus on the left is outlined by the black dots, and the thrombus is always going to be adhered to the underlying endothelium, right? Because it's always going to be attached to the blood vessel. And this thrombus can have different colors. It could be red or white, or variations of red or white, and this depends on how many red cells and white cells are within the thrombus. A postmortem clot is a clot that develops after the animal dies. So this blood clot is not adhered to the endothelium, and there's time for the red blood cells to settle. And the red blood cells settle at the bottom, so the bottom half of the postmortem clot looks red, whereas the plasma and the fibrinogen rise to the top because they're less dense. So the top will look like chicken fat or a yellow or whitish color. Okay, so now I'm going to go back to the original image to explain how an infarct looks grossly. So if you notice, the blood supply actually has a triangular appearance or a wedge shape. So if there is an infarct, if you get it at the right cut in the section, then that infarct will look wedge-shaped, and it'll also look well demarcated. So now I'm going to go to 2 images of infarcts, both in the kidney, to show what an infarct would look like on gross examination. So an acute infarct could look red or white, again, depending on how many red cells are within the infarct. But it will also be raised, so it will be raised above the surface compared to the chronic renal infarct, which will have a depressed appearance. And just like all infarcts, if you get it right at the right cut section, then it will look well demarcated and will perhaps be wedge-shaped. The chronic infarct has had time to undergo scarring, so chronic infarcts look white or tan, and they are also depressed because the scar has had time to contract and fibrose. These infarcts will also be well demarcated and have a wedge shape depending on the cut section. So that's it. I've gone over the definition of a thrombus, the factors that go into how severe a thrombus can affect a tissue, how to identify a thrombus at necropsy, and then also how to identify a renal infarct or an infarct in general at necropsy.